Bethesda Cares was created in 1988 as a direct response to the noticeable increase in people asking for help at area congregations. Knowing that small donations wouldn't solve the problem, the clergy turned to the county and area businesses to join with them in providing solutions. Back when we were founded, the expectation was this problem of homelessness would end with a recession. Our first steps were to provide lunches so no one would go hungry, an outreach worker to connect folks with existing services, and a counselor to assist with grants to prevent eviction and utility shutoff. From this, we've evolved to a housing-first agency that ends homelessness rather than maintains it. Preventing homelessness in the first place is still a very important part of our work. Bethesda Cares is seeking to end homelessness for those who are chronically, medically vulnerable, and unsheltered. We have most of the tools we need already in place, but to be fully successful, we want to update software, add Spanish language capability, and create housing opportunities. To keep people from becoming homeless, we seek to work on deeper grants and assistance, perhaps enlarging the definition of emergency. Leveraging the resources in our community makes us successful. We are blessed to have the National Institutes of Health and Walter Reed Medical Center as neighbors and partners. Employees at the NIH donate time and services, allowing us to access medical treatment for our clients. We have a new memorandum of understanding with the Uniformed Services University of Health Sciences. Doctors and medical students go out on the streets with our outreach workers to build relationships and offer treatment to those who are in need. Our office, lunch program sites, clothing closet, and shower sites are all donated, eliminating most overhead. We partner with area schools, congregations, and businesses who donate goods that support our programs by providing everything from socks to long underwear, underwriting and enhancing our work. Volunteers are the force that allows us to offer a variety of services that our small staff can't address. We have a fabulous staff that has the ability to make smart decisions. We stay mission-focused but are flexible and open to new ideas. We are data-driven and follow emerging best practices so that we can quickly incorporate them into our programs. We work hard at building community and volunteer support for our organization. "98% of the people we house retain their housing permanently. For our eviction and utility program, we have 4 new clients for every returning client, which indicates that we are assisting primarily those in crisis situations and only a small number who need yearly assistance. For healthcare on the streets, we measure the improvement of actual vital signs, such as blood pressure, over the course of a year. Bethesda Cares is named for where we are located, not whom we serve. Our reach is much broader. Confusion persists on our eviction prevention program. Our colleagues know that we assist people countywide, but some prospective donors think we assist only in Bethesda. Finally, our goals of easing and ending homelessness are sometimes perceived as conflicting goals, but we know that these 2 goals provide a pathway out of homelessness. The United States Interagency Council on Homelessness has named prevention of eviction and utility shutoff as the best practice to prevent homelessness. Our Housing Stabilization Counselor works in collaboration with other county agencies and nonprofits to stop evictions and utility shutoffs. All money is sent to the landlord or utility company. Our prevention program is available for all county residents, and last year we made 377 grants and kept 1,086 people in their homes. Our outreach program is the leader in solving chronic homelessness. We have been a partner of the National 100,000 Homes campaign that identifies the medically vulnerable, unsheltered homeless. We partner with medical doctors and medical students to bring health care to the streets. We partner with the Veterans Administration to identify homeless veterans and bring them home. Finally, our lunch program partners with area farm markets, which provide fresh food to improve the diets of those on the streets. Our biggest challenge is space. When Bethesda Cares was founded in 1988, The assumption was that homelessness was temporary, no need for bricks and mortar. Now, lack of space limits what we can do in our offices, and we have to run some of our services from borrowed spaces. This, ironically, makes us vulnerable to eviction. The upside is currently we have little overhead by using free borrowed space. With additional resources, we would get the unified physical program space to offer one-stop services rather than offering services at several sites. We would make deeper eviction grants for some who need the extra boost to stay housed. And on a smaller scale, we could use extra resources to improve our technology. We are program-oriented and technology is shortchanged. We'd also like extra time or people to write up our data, conduct research, and write up the results. With additional resources, we could go deeper in providing move-in costs, including the first month's rent, to transition those on the street with little or no resources into housing. With deeper resources, we could use the funding to pay for the housing itself. We don't have housing and don't hold the keys, so the medically vulnerable individuals we serve often have to wait months for the bureaucracy to move them into housing. Additionally, we could use funds to purchase software for electronic medical records. We would also like to develop a Spanish language outreach program.